Nurse-Raji blessing IB. Today I want to talk about the prostate. You might have been hearing the prostate, the benign prostatic hyperplasia. You must have been hearing about it, and even if you are hearing about that for the first time, you're welcome. So in order for us to understand why we need to prioritize the care of the prostate, why we need to have our PSA test done, then we need to know how does it look like, because majority of us do not even know how the prostate looks like. Yes, we know it's inside us, but we don't know how it looks like. So then we'll be drawing out how the prostate looks like. I'm not an artist. This is not your usual prostate. But something like this, right, is what you should try and figure out in that mental picture, okay? So, look at how the normal prostate looks like. We know it's a shape of a walnut shape, right? So, now, this is the normal prostate. This is how it looks like. Let's make it a little bit tiny. So this is how the prostate looks like, right? This is the bladder. This is your urethra. You can see. So it's wrapping the urethra, right? It surrounds the urethra. That's what it means. Then you have the bladder. So this is the urethra that connects to the outer part. Sorry. Do you get? So you have the urethra connect to the outer part. This is how you urinate, right? Then the urine or the ejaculatory content. So this is the urethra. This is the prostate surrounding it. Do you get? So now you understand that in between, this is the urethra. And you can see how spacious this is, right? This is the urethra. This is the prostate surrounding the urethra, right? And it's the urethra that enables the transport of the urine and the ejaculatory content. Now, for an enlarged prostate, let's see how this looks. So now, we'll just try and manage the space, right? So in an enlarged prostate, this is the urethra. This is the urethra, right? Then now, the prostate now becomes bigger. It becomes bigger in the size. This is your urethra. This is the urethra. So it becomes bigger. So because of the size of the prostate, right, it decreases or limits the size or the wideness of this urethra. It constricts it. It becomes like this. Do you understand? So now it becomes bigger. You see, this place, the size of what we have here is different from what we have here. You notice that the wideness of the the urethra, right, is more here. So because of the size, it then shrink or pressed on the urethra. So it makes it tinier. So just you having a fat person, a plump person, and a slim person like me, right? So you see the size, what the space that person will take will be more than what I will have. So that's just what we have here, right? And all this will also become inflamed. All this will become inflamed. Do you understand? Then, because of the weight, the size of the enlarged prostate, it will also push up, it will push up the bladder. Do you understand? So it pushes up the bladder. Of course, the upper part will push up the bladder. The one beside, right, this side will push the urethra. Both sides, both this and this. So when it pushes the bladder, what happens? And you know the bladder is the reservoir of urine. That's where the urine is stored, right? So now when it pushes it up, then you have it what? You have urine coming out. For a healthy man who is passing urine out, the stream goes like this. But for someone who has issue around the prostate, some people start having dripping of urine. The urine drips because instead of it to have a free flow out, this size will start looking for a way to come out. Do you understand? So I don't know how best I can explain this, but this is just the scenario. So this is why you're having frequent urination at night because of the size of the prostate resting on the bladder and constricting or restricting the flow of urine. Do you understand? So this is the normal prostate, and this now looks like enlarged. So let's name it here, enlarged prostate. I'm not an artist, but I'm sure that you're able to get it. So of course, with this, we still have something like this, we have something like this, we have the bladder. So this is the difference between a healthy prostate and an enlarged prostate. So this is it. I hope we're able to differentiate that. So now we've seen the difference between normal prostate and the benign the enlarged prostate, which we can also say BPH, benign prostatic hyperplasia. So now let's look at let's just see, this is it. As if this is our bladder. This is our bladder. So now this is the normal prostate. For abnormal growth, you understand? Abnormal growth in a particular organ or gland or a part of the body, right? So it means that the cells replicate. Abnormal growth of cells, when cells are replicating uncontrollably. Do you understand? So cancer cells are abnormal growth. For prostate cancer, we've seen the pH, the enlarged prostate. When we talk about prostate cancer, it means that the uncontrollable growth of an abnormal cell. So it's an abnormal cell and it replicates through the body. When a cancer spread, it also means it has metastasized. Cancer of stage 1, it means that in this prostate, the cancer is just confined within the prostate. It has not spread, but it's just still within the prostate. That's why you call it stage 1. Now for stage 2 cancer, it's still within the prostate, but a little bit more than stage 1. Okay? Now for stage 3, let's say somewhere like this. Don't mind the size. So the for stage 3 might be like this. So for stage 3, the cancer has spread, right? It has spread to even nearby lymph node. The nearby structures, right? Nearby lymph glands or seminal vesicles. Do you get it? So now, for stage 4 cancer, prostate cancer, this is where we call it advanced prostate cancer because it has spread outside the prostate. It can spread into the liver, it can spread into the bones, right? That's why you have most people who are diagnosed with cancer, they start telling you bone pain, And when it spread into the bone, it is not bone cancer. So when it spread into the bones, you only have the cancer cells in the bones, not bone cancer. They are two different things. So it can spread into the liver, the bones, some even the brain. Yes, as well. So we have some people that they say they've done their scan, and the scan cell, the test said revealed that the cancer has spread. Right? So it can spread to other parts of the body. So now it's important to note that cancer doesn't just appear, right? It's in stages. So it means that one can live with BPH, benign prostatic hyperplasia, for years, 5 years, 6 years, 10 years. There's not going to be symptoms, right? Gradually, if you're careful enough to notice the changes in your body, right, you'll be able to know that, oh, there's issue around urinary tubes. So before cancer sets in, it's very important that men should start carrying out their checkup test, because it's asymptomatic. It shows no symptom. You have no symptom. Do you understand? So one can have benign enlarged prostate without cancer. And before cancer sets in, you should be able to do what? To carry out tests. So those tests that will be done will be listed out as we continue educating. So we've seen the prostate, we've seen the enlarged prostate, and we've seen the prostate cancer, what it means, right?